Welcome to the show, everyone. I'm so excited about being here again today and networking with everybody out there. And we're live on Facebook, so I do want to say hi to everybody out there. Like us and follow us. You know, I love my show, and I really do. And the reason why I love it so much, again, is because of all of the information that's up here. That maybe it's you or someone that you know. That's what networking is all about. You can tell them. My first guests I have with me, Helen and Jennifer Walker. They are the owners of Walker and Walker Health Advisors. Welcome back, because you were on one time before. Mom was on. It's a mom and daughter team. I want you to first tell everybody a little bit about yourself and kind of what we're going to talk about today.
Sure. Well, I'm Helen Walker. My age doesn't matter, but I've been around a mighty long time in the healthcare business. And I work with my daughter, Jennifer, who all her adult life has also had a healthcare background. So between the two of us, we put together a very well-rounded picture of expectations of our healthcare.
Now, I want to talk about this because senior season is in the air soon.
Yes.
It's going to be October, you said the 1st, that you could start talking about it a little bit, and it's going to run all the way through December 7th. The first thing I want to talk about is I'm not going to change it. Okay, I'm going to do this on you because I was thinking about this.
Yep.
Somebody turns 65 no matter what every day. So when we're talking about Medicare for people who have to, it's not necessarily people who just are getting on Medicare. And we're not just talking about people who have to maybe change their plans, because if you're turning 65, you need to take care of it and get on Medicare.
Correct.
Right? So there's always a reason to listen and talk to somebody here, especially when you're turning 65, if you're over 65.
Correct.
So, and that's what I just wanted to get that out. But also I want to talk about the importance of talking to somebody local. Let's talk about that.
Sure. So first of all, for the newcomers just coming on, just aging in, it's always in your best interest to share your information, your concerns with a local representative. There are plenty of us. We all don't advertise, but you literally have hundreds of local agents available to you. And Jennifer and I are certainly here, but even beyond us, there's plenty to talk to. And you'll want to do that because we can help you with the concerns of, do you stay on your current health plan, or do we need to get on to Medicare? We just kind of have a little inside scoop on what's going on in our community, our healthcare that's offered to you. It's not the same everywhere. And calling an 800 number back east or wherever, they don't know what's around the corner for you. They don't know our current healthcare climate that's going on, the different hospitals and clinics that are available to you, and we're a source of information for that.
And here's the thing, this is so true. Somebody resonates with somebody else. It's just the way it is.
Very true.
And I am so glad to have you here and talk about this, because you're going to start getting a lot of mail.
Yes.
A lot of mail, and you're going to see a lot of commercials. That's just the way it is. And also, that's on television. That's going to be everywhere. You're going to see billboards, and here there's on the radio as well. But the mail is going to be a lot of mail, but one piece of mail is going to be super important.
Yes.
And that is what?
That's the annual notice of change. We call it ANOC, annual notice of change. And in the month of September, I need for all of you to be alert, because your mailbox is going to be full of a lot of paperwork. Most of it goes into file 13 or the recycle bin. But the one sheet that you want to look for is your annual notice of change. It is the plan that you're currently on. And it's going to tell you all of the changes that are going to be on that plan for 2026.
And you said before you came on here today, that's where a local agent comes in handy.
Yes.
Exactly.
Right.
Exactly.
And you got to read it. This is the other thing. A lot of times people don't, and we know even when we say you should read it, you're not going to read it. But and that again is why the local agent, especially them that are here to talk to you, that they can help you. But you have to read it. There's a good reason why. There's going to be a lot of big changes coming up, and you need to read it. Go ahead.
Yes, Jennifer, would you like to speak to some of that?
Sure, so what's gonna happen is you're gonna have a lot of information in that annual notice of change, or ANOC, but the main thing you wanna look for is, if you go back a few pages, it's literally gonna have your current benefits for 2025, and in the very next column, it's gonna say 2026. You'll be able to see if there's any changes when it comes to co-payments, any co-insurance, any supplemental benefits. It's going to show you exactly what is going to happen, if there's gonna add to it, if they're gonna take away, so you can make an educated decision. Do you still want to stay with this plan for the next year?
And I'm gonna tell you, most time, it's gonna be added to it, added to it, added to it. That's what's been
Yes.
happening with the last couple of years with everything. So please make sure that you speak to somebody local. Their phone number to call is 602-750-0620. They are statewide, and there's no charge for this service. That's the other thing. There is no charge for the service, so it just
Correct.
makes sense. Please call someone local. That's something that they really, really, really want. And read your ANOC. They want you to do that too. And call them with your questions, because it just makes sense too. I want to talk to you about some of the things before we go to a break here. If someone already likes their plan, do they have to re-enroll?
They do not. So if they like their plan, I'm gonna go back and remind you, look at that ANOC to make sure, because what you like on your plan this year, you wanna make sure it remains the same for the following year. But if you like that, you don't have to do anything, and you'll automatically re-enroll in that particular plan for the next year.
How important is it though, even though they like it, to find out from you whether there isn't something a little bit better than what they have already? Can you tell them that?
Yes, we can. So our particular Walker and Walker setup, everybody doesn't do that. But for us, you're gonna hear from us in the month of August and September. And we're going to send out a questionnaire that basically says, how do you like your plan? A lot of times your lifestyle has changed, maybe your health conditions have changed, you have extra concerns. So we send out an assessment for you to complete and return to us. And we will review that assessment to help you determine if you want to stay where you are, or are they introducing a new plan next year that will better service you.
See, that's why you have to talk to somebody who's local, number one. Number two, they, it's a free service, so it really just makes sense. But making sure that even though you like what you're on, and a lot of people do, they like what they're on, but they don't know what's around the corner and what might be new. And that's why it's so important to talk to them. Again, they are statewide. It is a free service to you, and their phone number is 602-750-0620. Their website is Walker Health Care Advisors with an E, so .com, and then again it's Walker Health Care Advisors with an E.com. But listen, folks, whether you're turning 65, have that, or you already are, I should say that way too, or you already are and you're in Medicare season, you know that you're going to want to talk to somebody. Please do not call the people on television. Please read your mail. Check it out, because they're going to help you with that, and you're going to see right away what those changes are or are not. So again, their phone number is 602-750-0620. They're statewide. Their website is Walker Health Care Advisors is with an E.com. Hang tight. We are going to be back in just a minute. Okay, we're gonna keep on talking in this room. You can take those off and get a little comfortable. Hope you like what I'm doing, okay?
Yes.
And liking it a little bit different than the last time? Yeah. Okay, so we're gonna keep on talking. When you work with somebody, okay, how many times do you find out that somebody's medication changed, okay? So it's not just a one and done.
Correct.
Let's talk about that.
Sure. Well, first of all, lifestyle is always changing, okay? It doesn't necessarily mean bad health, it's just sometimes lifestyle, the requirements that are put on you for everyday living. And sometimes moving around is, you have a summer home here, a winter home there, whatever, and you want to be able to be covered in those different areas, or so forth and so on. Sometimes it is chronic illnesses, you didn't have one before, you do now. Sometimes your financial situation changes. Before you were financially stable, now you have to get assistance from the state. We have different plans for all of those types of scenarios.
And I do think that a lot of times people don't realize that when, let's say your Medicare changes, you gotta call them, you
Yes.
gotta talk to them, you know? I mean, they're gonna help you when it comes to paying for your medication.
Yes.
That's the big thing right there. And I know people that, you know, up until even almost in December,
Yeah.
they get a new prescription because, you know, we get sick. And I find that the prescription dollars is probably the
That's a
number one
big
reason,
deal.
right?
It's a very big deal, and you wanna make sure that you let your agent know when you've got something
I would
else.
imagine.
Because we can also tell you, we've had people that it matters where they go pick up their prescription. They can go to one place and it costs them $5, but then they go down the street, that exact same medication, because of the insurance company, it's gonna cost them more because they prefer you go to location number one. So we ask those questions. What's the medication? What's the dosage? But where do you go pick it up? Because we can tell you if you can save some dollars.
Absolutely, that's what it's all about, wherever we
Yes.
can. Let me, I'm going to say, it's okay. So welcome back, everyone. We're talking senior right now, and we're still live on Facebook, so hi to everybody out there, like us and follow us.
Hi guys.
And we right now are talking with Helen and Jennifer Walker. They are the owners of Walker and Walker Health Advisors, and their website is Walker Healthcare Advisors is with an E, and it also has an S on it, .com. And we want you to write this number down. First of all, you might need it to be, maybe you need getting ready to get onto Medicare, or we're gonna get, Medicare season is in the air soon, and so that means that you're gonna wanna make sure that you have somebody here local that you can talk to. And call them now, don't wait until October, call now. That phone number is 602-750-0620, they are statewide, and this is a free service to you, it just makes sense to do that. At the break, we were talking a little bit about prescriptions
Yes.
and how important it is to tell, if you have a different one, which, you know, I think if you're a senior, you get a new one almost every other day, you know, but that they call you and talk to you because of what?
You wanna make sure that we're aware of what's happening, because we can let you know on your plan what it's going to look like, and even more importantly, where you're picking up your medications is another thing where you can save dollars depending on where you go, or even if you get it via mail order versus going and picking up that 30-day supply at the pharmacy. So there's different avenues with it, but we wanna know that name, the dosage that you're taking, so we make sure that your carrier covers that for you.
And that's big time because, you know, it's all about the dollars. If you
Yes.
can get it less, even if you have to go, and most people might have to change your pharmacy, you know, okay, so you might have to drive 5 minutes more, but guess what? You're paying less, and that's what matters.
Exactly.
Now, let's say somebody was on their plan and they liked it or whatever. Now, maybe they change their mind. They're not sure if they like it. What happens then?
The biggest time that happens is someone that is married to their doctor, and their doctor has now decided that they're moving shop, or they're no longer contracted under a specific plan that they're on.
That's the worst.
It happens all the time.
Right.
I've had people that they literally go to the doctor's office and the doors are closed and locked and they had no idea that they were gone.
That's terrible.
But they find them and they wanna switch plans.
Mhm.
So you always have the option, especially during annual enrollment period. You've got October 15th through December 7th. You can change as many times as you want. And the big thing is the last enrollment application that was submitted by December 7th is the one that's gonna go into effect.
Okay.
So they can change as many times as they want during annual enrollment. And then for those that are on Advantage plans, you have open enrollment as the first quarter of the year, January 1st through March 31st. You have the opportunity to make a one-time change from one Advantage plan to another, and that change go into effect the first of the following month. So if you call in January, it goes effective February 1st. You call March, it goes effective April 1st.
Okay.
So you're never truly just stuck. People worry that, oh my God, I've made this change, or I've made this decision and I'm stuck with it forever, and you're just not.
And I think a lot of, especially older people, they don't even wanna change. And the only reason why they don't wanna change is because they don't like change,
Exactly.
right? But change is good. It could be very
It can be
good.
good.
It can be very good, and the only way you know is by having this free consultation with them. And they work statewide. Their phone number is 602-750-0620. Their website is Walker Healthcare Advisors, is with an E. So, and that S is also at the end.com. I wanna talk about the alphabet soup because there's so many different letters in Medicare soup, and, but each alphabet actually is gonna be for each individual, and it could be different for each individual, correct?
It generally is. So that's the reason we have so many different plans, because you have various needs. And more than likely, if you run across a person that is just in love with their plan, more than likely an agent did an excellent job of fitting their needs with the right insurance plan. And just because it worked for them does not mean that exact plan is what you need, because your healthcare needs are different, your financial needs are different, your wants are different. Some clients are literally, they love their physicians, can't live without them. You could take it with a grain of salt. Some are very sickly, you just never go to the doctor. It's a variation of what your needs are, and that's the reason there's so many different plans. And so when we do an assessment, we ask some very specific concerns that you have and what your wants are, what your needs are, and we try to match you with that.
And let me just say this too, it could be in your own household that it's
Correct.
different, because your wife is gonna, or whoever your significant other, could have very different needs and
Yep.
wants as you, or your health is totally different.
Correct.
Right? So you wanna make sure that you don't just talk to your neighbor or your wife, no, that's not, you talk to your wife.
Yeah.
But really, it's very important, this is an individualized plan
Yes.
Very
set
much.
for you. And I know it's very confusing, a lot of people try and do it on their own, they think that they can go up onto Dr. Google and they'll know exactly what to do, but unfortunately you won't, because you've not been in the healthcare industry as long. Helen, I gotta ask you, okay, how long have you been in this industry?
I've been in insurance all of my adult life, but just the last 20 years, just Medicare alone.
Mm-hmm. And well, so she knows, right? You know that she knows, and you've trained your daughter, right?
Yes.
And now, you've been in it now how long?
I've been in healthcare for over 15 years,
Wow.
specifically with Medicare for 4.
Okay, and and having the mother-daughter team is kinda nice, right?
Yes.
Right? And I love that you do that. You also do seminars, we've talked a little bit about that.
Yes.
And talk a little bit about them and when you do those.
Sure. So throughout the year, there's so many of us turning age 65. We will do a combination of turning 65 seminars. We will do what we call Medicare 101. Some of you are on Medicare but never really been introduced to the plan. It was just kind of something you turned 65 and you jumped on it and nobody really explained anything. So we do one-on-one seminars. We can do product seminars. In the past, we would go for various carriers and explain to you the various products that they have. And then we also just, throughout the community, we'll come to your church, we'll come to your local gyms, we'll come to your community centers, and just provide you with general information about Medicare throughout the year.
You said it earlier, that I really like the way you put it. You know, you really should call somebody local. There are a lot of people out there.
Yes.
What's nice is that you hear the people like you here on this show that had the opportunity to have a platform to, you know, kind of talk and hear them. I think that's really important,
Sure.
that you do be able to do that, because no one would know.
Exactly.
Exactly. Where else but on Networking Arizona can you do something like
Yes.
this? Now, you get the number one question asked all the time. What's the number one question that you get asked all the time?
What is it, Jennifer?
What is the best plan out there?
And
And-
what is the best plan out there? What do you say?
It depends on what you need.
There is no best plan out there for you until you find out what really is the best plan out there. You can't, it isn't just, oh yeah, well, this place, this carrier is great. It doesn't work like
No.
that, right?
It doesn't work like that at all. And please, as friendly and helpful as you think your neighbors are, or your hairdresser, they only know what they know for themselves.
And
You-
Joe, go
I'm
ahead.
sorry, go ahead.
Joe Namath is not calling you back.
No.
He is not.
I have to say that because it's kind of funny, and I just want to say, because honestly, a lot of people, I mean, there are gonna be even more Medicare
Yes.
back to back to back to back. And they can be a little bit deceiving. I want people to understand that you need to really find out what it is that they're talking about too by calling a local agent such as these people.
Yes,
Correct.
they are going to do whatever they need to say to you to have you call. That is the whole purpose. And no
Ex-
matter what, they're gonna tell you they've got something better. That's how they make their money, is to change no matter what. You could have had somebody come and spend an entire afternoon with you and go through your specific needs, but that person on the end of that 800 number is gonna tell you, oh, I've got something better, and then you'll turn around and find out they don't cover your doctor, they don't cover your medications. Don't call them, you call local.
Call local, and their phone number is 602-750-0620. They work statewide. There is no charge for this service. And they're telling you, please, there's a lot of them out there. Please call them. They would love it. But you know, no matter what, and you can't have the entire phone book, you know.
Exactly.
So honestly, there are so many people out there. If you resonate with this, please call them at 602-750-0620. It's Walker Healthcare Advisors with an E and an S.com.